Well, good morning, Team Neomed. I'd like to start, as I've been doing for the past several months, by first recognizing some of the accomplishments of our team members. Over the last 2 weeks, I've learned that Dr. Bond has been awarded a new grant by the American Academy of Family Physicians, and Dr. Jesse Young received a large award from the National Science Foundation for his work. So congratulations to both of our outstanding faculty members. I also want to announce to you that we've transitioned from Erie Island coffee to now a proudly served Starbucks coffee in our new center. Many people brought to my attention early on that we needed to change the quality and the caliber of the coffee we were serving in the new center. And thanks to the work of Mary Taylor and her team, we now have Starbucks. I look forward to seeing many of you over there as we continue to support the university and purchase our coffee, drinks, and other food items that will be available here on campus. For our faculty, we've got a continued dedication to developing our faculty through education, assisting them with their research work, being great educators, and of course, helping them through leadership development. This week, due in part to the great work of Dr. Schmidt and his team from the Vice President's Office for Research, we're holding Writing a Winning Grant proposal. Really pleased to see that 34 Neomed participants, our faculty, will be in this educational session, which is co-hosted to also support other Northeast Ohio University faculty from across the entire region. For our staff, an update, we have completed the pay scale and position appropriate assessment for all of the jobs that are in our staff positions. This was completed by a group called Milliman, who is a consulting group, who are experts in this area and has helped us through understanding whether or not we are appropriately structuring our positions relative to pay scale, and whether or not we are appropriately paying individuals for those positions relative to the local market. We're expecting a final report out from that approximately the 24th of September. However, the initial reviews that have been provided to me by Milliman show that we are in very good shape. We have a couple of areas that we do need to pay some attention to, and we'll work on getting those corrected over the course of this next 1 to 2 years. But for everybody else, we are actually in pretty good position. We'll be sharing that information with you as that continues to evolve. Our HR team has also been working trying to determine whether or not we can find a better healthcare benefit solution for our employees. As you know, last year we had to change our benefits. We eliminated our enhanced plan, which many people had signed up to participate in, and reduced it down to an 80-20 plan, where 80% of general benefits were covered by the health insurance plan and 20% were co-paid or shared by the employee. That is a standard plan that's being used at almost every organization, both public and private. But we are looking for ways to improve upon what we have available, while also looking for ways to have our employees pay less for their health care. So better value overall, improved quality, or at least maintaining the quality of care that we have, including the network, as well as reducing the costs. I think we're getting very close, and I hope to have something to announce to you by October 1st. A COVID-19 update. I shared with you on my last report that we had students who were positive with COVID-19. It was a limited number at that time. However, because they had been in classroom with many of the other medical students, the Portage County Health District asked us to quarantine a number of students. In fact, approximately 96 students have been quarantined. I'm pleased to say that the majority of those students are now off of quarantine. Only one student who was quarantined came back as possibly positive. What I mean by that is he had one positive, or she had one positive test. However, quickly had 2 negative tests, and it was unclear to us whether they had converted to a negative status that quickly or whether it was a false positive that we were seeing in this student. Either way, we expect that student to be released soon, and we will have all of our students off of quarantine by Wednesday. I also have been informed that we have 4 third-year medical students who were possibly exposed at a clinical site. They have not been on our campus. Per the county regulations, they have not been placed in quarantine and are just being monitored, as they are treated as healthcare workers, and healthcare workers will continue to be monitored, allowing them to participate in their clinical rotations while we evaluate them to determine whether they develop symptoms. So we're doing very, very well. We have not had any faculty or staff reported as positive for our COVID-19, either through testing or through presumptive diagnosis due to symptoms. And we are continuing to run our College of Pharmacy in a hybrid model, both here on campus as well as using virtual educational means. And our graduate students continue to be present on campus, conducting research in the research laboratories of our faculty members. So very pleased with where we are. We're doing a great job with the policies and protocols that we have in place. I've had conversations with the presidents of the other public universities. University of Cincinnati and others have shared they've had about roughly 12 students per day positive. They are doing asymptomatic testing. And the Ohio State University president announced they had about 1,500 positive students, or 4 to 5% of their population, which is exactly what we would expect, because that is about where their local community is, about 5%. This is asymptomatic. They've chosen to do asymptomatic screening. Most of the public universities in the state are not. Flu shots, as I noted, will be mandatory for faculty and staff on campus this year unless you meet the state exclusion criteria due to underlying health issues or live with somebody with underlying health issues. This is really critical this year because we know that during the fall and winter months, we see an increase in both streptococcal infections as well as influenza virus infections. And these diseases both have symptoms that are very similar and confusing for patients who may have COVID-19. There are also other typical viruses and bacterial infections that are transmitted this time of year as we start to see people get what's often called the crud, just not feeling well as we enter into the fall and winter months. Many of these, all of these in the past have not been due to COVID-19. This year, the complicating factor, of course, is presenting with those symptoms and trying to determine whether people are experiencing COVID-based symptoms. So it is important to get the flu shots to ensure that we have a reduction in the number of people who are coming positive with flu-based symptoms. And at the same time, we do expect a reduction in, at least a possible reduction in number of patients actually becoming positive with the flu as we're following the COVID-19 protocols of social distancing and face coverings. The shots will be available on our campus through the College of Pharmacy to our students beginning this week on the 17th, and then beginning next week to our staff and to our faculty. So please ensure that you get your flu shots. Look out for both your health and safety as well as that of our community. I'm pleased to say we had a very successful Board of Trustees meeting last week on Wednesday. At that time, our board formally endorsed our new strategic plan. A big thank you to everybody who participated in that, especially for the 46 individuals who came and gave of their time to sit in working groups, reviewing the document and helping us create a really outstanding plan. The marketing and communications team has taken that plan and both created a website, which will be released very soon for all to view. And they have also created a really well done and graphically enhanced strategic plan that we will be releasing either today or tomorrow for everybody in the community to be able to read in detail should you choose. I encourage you to please do so and at least be very familiar with our new mission statement, our new vision statement, and of course, our core values. Now we begin the intensive work of taking an approved plan and implementing it, operationalizing that. That's going to require us to tie our metrics to the plan that we've created and create tactics to allow us to achieve that, while also resourcing the plan to ensure that we have the proper amount of human capital and of course financial capital to make that plan come to reality. Be more than just a dream, but to be something that really allows us to shape this university for the future. And I'm very excited about where we're going. We also had two new master's programs approved at the board level. This is the first step for them to go forward with accreditation, first to the chancellor's office, then to the HLC. And for one of those, it'll move on to a national accreditation council. These are being created by the College of Graduate Studies. One of them is a master's degree for a certified anesthesia assistant program, and the other is a master's degree in healthcare leadership and management. The formal name is yet to be determined for that program, but a big thank you to Steve Schmidt and his team for all the work that they've done on these, as well as the partnerships and coordination with the College of Medicine and the College of Pharmacy. I do want to recognize Mr. Paul Bishop. A special thanks to him. He has served 9 incredibly dedicated years as a board of trustee for Northeast Ohio Medical University. And this last year, he has been the chairman of our board. He will officially come off the board of trustees near the end of September and has stepped down now as chairman. He was an incredible supporter of NeoMed, both through his leadership and service, as well as his generous philanthropic donations by him and his wife, Jane. We have new leadership elected. Mr. Richard McQueen has gone from being our vice chairman of the board to now our chairman of the board. Mr. McQueen, also a dedicated member of the board of trustees. Really excited to be able to work with him in strong partnership over the course of the next few years. And Mr. Phil Trueblood has been elected as our new vice chairman. And again, looking forward to continuing to work with Mr. Trueblood, who also serves as our chairman of our finance subcommittee. And with that, I'm keeping this shorter today so that I can open up the opportunity to address your questions.
Yes, the first question, can family members come to NeoMed for their flu shots?
My understanding after speaking with Dr. Kasmer is that yes, that will be available. First, we're taking care of our students. And then as we open it up to faculty and staff, that family members will be able to come in. If I'm incorrect on a piece of that, Dr. Kasmer, please correct me, but I believe that was the discussion we just had.
The next question is, has any thought been given to holiday break time off?
Yes, that actually was just brought up this morning. I'm going to be meeting with our chief of staff to have a discussion about that today. And I promise to have an announcement for you at my next update before October.
Is the benefits split meant to be 80-20 split across faculty or staff, or is it intentional for some of us to shoulder over 20% of medical coverage?
So there's two different things when we refer to an 80-20. There's the averaged out 80-20, which is used by the majority of public universities in the state, and that is towards contribution. So we average out that 20% of the cost of healthcare policies go to the employee and 80% goes to the university to be able to cover. We do have a tiered approach to this so that those individuals who are in the lower pay tiers are not taking such a tremendous burden to their paychecks as we work to ensure that they and their families are insured. And then there is a higher amount in that tiered process for those who are in the higher pay scales. That is true. When I was referring to 80-20, I'm referring to the coverage levels. So most insurers provide an 80-20 coverage, meaning once you hit your deductible level, that any catastrophic or large claims, for instance, hospitalizations, surgeries, et cetera, within network, that the insurance company covers 80% and the employee or the insured person pays 20%. So those are two different areas, and it's important to make those distinctions.
State laws allows matters of conscience to refuse vaccines based on religious and religion views. Are we upholding this?
We are going to follow state law, period, on this. And so our team is reviewing that information, but we will follow state law. I do encourage all of you to get your flu shots. We're doing it not just for you, but for each other. All of you have been at different levels of concern or anxiety over COVID-19. And when flu season hits us with the crossover in symptoms, it's going to make it more difficult, and it's going to really complicate the picture in understanding who has potentially COVID-19 versus who has influenza virus. And by getting vaccinated, one, not only are we helping to reduce that burden, but two, we're also reducing the morbidity and the mortality associated with the flu. That's something that's been highlighted more now in the news as we've been dealing with COVID-19, is that the flu itself is a disease that has a fairly high mortality rate. Now, yes, it's less than 1%, but if you are part of that less than 1% or your family members are, that number doesn't matter. It is a disease that people also die from, and it's usually people who are in at-risks and older populations. So like all vaccines that are important to keep us and the society healthy and safe, we ask you to do that.
Over the past 6 weeks, some of us who were required to start working on-site full-time have had very little in-person interaction with student, faculty, or staff, and we've had to sit in isolation in small offices and cubicles. In this reality, is NeoMed leadership willing to revise its new policy and allow staff to work remotely for more than 2 days a week until the pandemic is over?
We are just implementing our new policy, and we're going to allow that policy to play out for several weeks to a month, unless instructed otherwise by the state, and we will reassess consistently as it's implemented and make decisions based on the outcomes. We have a safe campus. The data has shown that. So we also feel it's very important for people to come to campus and to be part of NeoMed and understand who we are, the culture, and to perform work on campus when possible, while also de-densifying and ensuring that the campus is safe. So the new policy was just created and we are just implementing it now. So let's give this some time to see how well it plays out for us.
You previously indicated there would be a scholarship for employees impacted by the elimination of their educational benefits. Will this still be an option? If so, when will information on how to apply for the scholarship be available, or who should employees contact to learn more?
So those scholarships were specifically for employees who were in a particular pay range that were impacted by this. And my understanding is those scholarships have already been awarded. I will ask HR again on this topic today, but in our last meeting, they had informed those who were eligible and had already received applications for that. Our intent with those scholarships were to really assist those who were in the lower pay scales who had greater impact from this COVID-19 issue that we had to implement in order to reduce overall expenditures at the university.
What is the status of the faculty compensation plan that was in development?
Still tuning that up. As I mentioned, I hope to have something available to share with our faculty by early October. But thank you for the input that I've received from faculty members, from the input that I've received from the chairs and the deans, and the input that I've received from the University Faculty Council. Again, as we look at rolling out this additional compensation plan, it will be an opt-in, so nobody will be required to do it. You'll be able to look at it, make a decision on whether you think it will benefit you as we test this new type of plan out. But stay tuned. We will get something out by early October.
If we have a health reason that we cannot, excuse me, sorry. If we have health reasons that we cannot or should not get a flu shot, should we bring these exceptions to HR?
Yes, HR will be sending out information on this to everybody. But that is exactly correct.
Is the new educational benefits policy available and will it be officially published? Will the university consider rolling back changes to the policy coverage if our budget does not experience as drastic a cut as expected in the future?
We're going to look at every cut that we've had to make because of COVID-19 economics over the course of this year, and we'll make decisions regarding any potential changes to all of them, including that particular program. My understanding is that HR had already released what we're doing and has it implemented. It should be on their webpage. I will confirm with Mr. Burton today. I would encourage you to look on the HR webpage where I would expect that information to be available, but I will verify.
Have we looked into joining other universities and colleges to leverage insurance plans?
We have. I've had lengthy discussions with all of the Northeast Ohio University presidents regarding this opportunity. We've also had discussions with the IUC, or the Inter-University Council. And to date, the evaluation of the other Northeast Ohio universities have shown that the current plans they have would not benefit Neomed and assist us in getting our costs down. I do believe we have a solution that I'll address to you in the next 2 weeks that will have big impact. We expect to have big impact on reducing your costs while either providing you the same level or better level of care. But we are still evaluating that opportunity now. The Inter-University Council has not moved very quickly on this. These are discussions that have been going on for quite some time, but there has not been a consensus opinion on this to be able to get things going. So we're hoping, but in the meantime, I need to move forward with trying to get your costs down while ensuring that you have an appropriate or better level of care than we currently do now.
Does the pharmacy have nasal spray flu vaccines for children?
I don't know that answer. Perhaps Dr. Kasmer could put something down onto the chat box. I just don't know. I don't believe we do. I think we just have shots.
Is a Neomed receptionist going to be in place soon?
No, what we've decided to do was leave the receptionist position empty. And we've also, as part of the COVID-19 cuts, had removed 2 administrative assistant positions. So we actually don't have an administrative position, a position in the president's office at this time. We have about 7 of the senior leadership members who are not being served. And we are just making do during the COVID economic cuts. Once we do eventually bring somebody in, that individual will likely, that's the intent now, put them out in the reception area so they will be dual purposed with both serving the reception role as well as serving as the administrative role for a number of our staff who are in the president's office.
Has leadership decided how to handle the payroll tax deferral executive order?
We have not chosen to handle that yet. We'll work with the HR team on this. We've had some minor conversations, but have not really gotten into any of those details. Perhaps Mr. Burton can make some comments now on the chat box. I see that he's also recently noted that regarding educational benefits, please contact Diana Taylor in Human Resources. The new educational benefits policy is available on the intranet for others to review. Mr. Burton, if you could comment on the payroll tax deferral, I'd appreciate that also. Thank you.
Final question, will there be an extension to the child care plan for employees who have not been able to use it yet?
No, we have not talked about doing that. We gave everybody until September 9th. Then we put in the new flexible work hours arrangements that you can work with your supervisors on. And of course, we will be following any of the requirements of the federal COVID-19 rules. So please work with your supervisors and the HR team.
There are no further questions.
Thank you, Michael.